You're recording?
Yeah.
We are.
Can't see it.
That red light mean it's recording?
Yeah.
It's recording.
So if I want to zoom in, I go like this.
And then, okay. And zoom out. Okay, and then sweep over this way. Slowly.
It's very blurry.
And internal medicine. Pull it up. There we go. And then just show doctors walking along. And show those
Okay.
people.
Okay. Go.
Okay, we're here at the Gunderson Clinic Lutheran Hospital, and we're here with Dr.
William Agger.
And what sort of doctor are you?
I'm an internist. That's a doctor who studies internal medicine problems, and I subspecialize in infectious diseases.
Okay. How does your job deal with AIDS?
Well, we help in the diagnosis and treatment of individuals who are infected with the HIV virus, which is the cause of AIDS.
So do you actually have to go and talk to the people?
Frequently.
Is that hard?
No, we in medicine take care of a lot of people with a lot of different illnesses. AIDS and HIV infection is just one of them.
Okay. Do you know, are there any other immune deficiency diseases you know of?
Oh yes. AIDS is the one caused by the virus, the human immunodeficiency virus. It is a virus that wears out the human immunity system.
Yeah.
Happens to wear out the lymphocytes that help modulate infections. Now, there are other causes of immunodeficiency. Some people are actually born with immunodeficiency because their bodies never developed right, just like some kids you've seen that haven't developed in the normal vision or backbone or many other areas. The immune system is one area that occasionally doesn't develop right. Fortunately, not very often.
Do they die then if they're born without one?
If it's severe, I think we all know about the baby in the bubble. That is a child that had a very absent, actually, immune system, and he eventually succumbed to that. But there are other immunity problems that can occur that are much more mild, and some people, yes, make it to adulthood and all full life, but only problems of minor or moderate recurrent infections.
Do you see any children with AIDS?
Not very commonly. In La Crosse, in this area, we have very few children because we don't have as much man to women and then women to developing and child, or the child as the child actually is born, infections. We see more transmission by other means than what we call as man to woman or heterosexual transmission. We see more homosexual transmission.
Okay. So do you have to go in and tell the patients that this is what they have? Are you one of those sorts of?
Yes, sometimes people come to us not knowing their diagnosis, and because of their particular symptoms that they're having and physical findings that we find, we run the tests and occasionally have to tell an individual that they are infected.
How does this affect them? How do you know how
Well, they're
react?
often surprised and shocked and very much depressed. So you have to help them through a very difficult time in their life, perhaps the most difficult time.
How does it affect you having to go in? Does it make you sad?
Well, it does, the whole process makes me sad, of course. It's a difficult problem. Most people that went into infectious disease went in with the idea of curing people of a problem. That to date has not happened with AIDS, but we're getting closer with our newer medications.
So how do you treat it then?
Well, the HIV virus is treated with 2 or 3 or sometimes even 4 different antivirus medicines now that have just become available in the last few years. With that treatment, we are showing that we slow down the process of the immunity loss very rapidly. And for a period of time, it looks like we're helping people's immunity stay stable.
So about how long do they live if they have HIV/AIDS?
Yeah. Well, if they
average?
don't take any treatment at all, the average life span is about 7 to 10 years.
With
With
HIV?
once you become infected, yes, it's about 7 to 10 years. Some people much less, some as short as a year or two even, but most 7 to 10 years if you don't receive treatment.
If they do?
Well, if they do, we don't know how long because the treatment has just been out, and some people respond very well and may live a life that's pretty good,
So, long.
a longer time.
What's the difference between regular AIDS, full-blown AIDS, and just like I guess
HIV.
beginning
Yeah.
AIDS or HIV?
Well, HIV infection means you've become infected with the virus. As the immunity slides downhill towards that 5 to 7 year mark, you go to a spot where you begin to get infections or cancers that normal people don't get. And at that point, the individual is called a full-blown case of AIDS or acquired immunodeficiency syndrome.
Once they get there, about how long do they live?
That again depends if they're treated and how they're treated. If they
Yeah.
go untreated, the life expectancy is about 50% die every year. So the chances of survival are very
Once they get
limited
AIDS.
if they don't receive treatment. With treatment, just to protecting them against some of the common infections, they can live 2 or 3 more years. And with the new antivirus medicines, they can live quite a bit longer. But their life expectancy is still going to be shorter than most.
What are the side effects from like the treatment? And they like get sick?
Yes, you can imagine having to take 3, 4, 5, 6 drugs 3 to 4 or 5 times a day, and you can imagine many people do get nauseated and even some vomit, and some get rashes, and others get neurological problems from the medicine. So there's a lot of potential problems from all this medicine.
Do you think they'll be getting a cure or something like that soon?
No.
Are there certain like plants or something that can actually slow it down other than there's some
Pills.
drugs like AZT or something that help?
No, there are not. There's a big difference in this world between making an observation that would lead someone to believe something might work and proving that it does work. The proving that it does work for a scientist and a medical scientist is to check against a group taking a placebo and the drug. And the trouble with the nutrition fad that you often see is that just because something makes sense doesn't mean it's so. And the testing to prove or disprove with a nice experimental test is usually not done. So we've seen a lot of that with the AIDS cases, people believing that they could take a little bit of apricot or what have you, that they could live longer. But again, that would require taking apricot and a placebo and comparing the outcome of a large number of people. And when you do that sort of thing, you find that apricot bits don't work. So, yeah.
Do you have to like give them the medications and stuff?
Do I personally?
Yeah.
We give them some medicine here in the clinic. Most of it is a prescription that they take it home.
Are you ever scared that when you come to see these people or you have to give them medications, are you ever scared that you'll get it yourself?
No, because you don't transmit this virus by just casual contact, not talking to someone, not shaking their hands.
Like,
I know,
and so
if
we
they
know
have
that,
like an
but-
open cut and you're, or if you have an open cut and you're like giving them a blood transfusion or something.
Or yeah, don't you
Or
have?
do you ever have a feeling?
Well,
that
of
you
course,
might
if we're
get it?
giving them a blood transfusion and the blood from a transfusion gets on my open cuts, that blood has already been checked for HIV virus, so it's not going to be a concern. However, I think all of us should take care around blood to wear gloves and take precautions not to get blood on open cuts. There are not only HIV viruses, but other viruses that can be transmitted. Hepatitis virus, for instance.
Is there like an bug or another kind of organism other than humans that have gotten AIDS or HIV? I know HIV is just for humans, but
Sure. It turns out there are other viruses in the same group of virus that HIV comes from, called retroviruses, and they can occur in monkeys, and some of the monkeys, if you give them a retrovirus from a different type of monkey, can be made to get sick. But as it goes, it looks like most of those viruses have not caused diseases in their regular animal host.
I have a question. This is kind of off questions we have.
I have one more.
Okay.
Okay, wait, I'm gonna just stop.
Okay, wait, start over.
This is the histology laboratory. This is where we examine tissues.
Not the blowing your nose thing.
Come over here. On these cutting boards, the tissue that comes in from surgery is cut down, and then it's put in those little plastic boxes. They're called cassettes. Goes over into those machines over there.
Which machines?
Along
Like this?
the wall. This machine right here. And then it's put into wax.
Is the wax in here?
Yes. And then come over this way.
Wrap it up.
Wait up, peoples!
You just put that on tape.
People here cut those wax blocks. Here's one of these wax blocks. And I cut it very, very thin, put it in a sheet of paper, and put it on a glass slide. Can I have a glass slide?
Yes.
Put the piece of tissue on a glass slide. You can see the tissue right there. It's all embedded in wax. And then they put it through another process that takes the wax out and stains it.
Do they stain it so that you can tell the difference in the wax?
And then the stain slide looks like that. You hold it. It's pink and blue.
And where do they stain it?
The machine right behind you where they stain it. This machine that says auto stain.
So each one is a different color, and they stain it, and they dye, and they put stuff in, so you can tell what is what.
Okay, so I'm going to turn it off now.
It's off.
Ah. There we are, Dr. Lawrence Seberg. And here we are.
Once we get those slides made, we put them under the microscope and look at them. Unfortunately, can't take a picture of that.
Can't we?
You could try putting
Oh,
it up
cool.
to the,
Okay.
put the lenses up to one of the eyepieces and see what it looks like.
Can you see it?
Okay, all you see is black. Put something in there.
There is
there
something
is.
in there.
Put it
Is
in
that
again.
as the light on?
Yeah,
No.
that won't work. Okay, well, we just,
Hold on, there we go.
There we go, there's light, but that's all we see is light.
that's about all you can see. Anyway,
Turn it off.
No, oh, I see stuff. See, there's little speckles.
yeah, those are cells.
Those are cells, everyone. See those little speckles?
Okay.
And this one my dad looks at all day.
Yep. And now you may turn it off.
I don't want to turn it off. Here we
Right,
go.
well, then we can talk a little bit more about AIDS. We can diagnose AIDS in the laboratory. There's a blood test for the virus.
And you put the blood on the...
Not on the slides, it's a chemical test. And then, but we get tissues from AIDS patients because the big problem that AIDS patients have is only partly the virus, the HIV virus, but we get a lot of other infections too. And so we diagnose other infections. There's a kind of pneumonia they get, it's called pneumocystis pneumonia. And we diagnose that by looking at it under the microscope.
Oops, sorry. Okay, and so
And
that's
of
what you do?
course, he has got pictures of his son and his daughter.
We won't see the pictures of those pictures, but hang on. There's the books. This is all the stuff you have to learn to become a doctor. Maybe this stuff won't.
And especially this.
Okay, no.
And this has to be in here.
Okay, well, that was just lovely. Thank you, Dr. Bird.
You're welcome.